Hey, do you have insomnia? In this video, I'm going to share with you over 80 contributors to insomnia, explaining why people have difficulty falling asleep, staying asleep, or sleeping in as long as they want. Don't turn away, because that starts right now. Hey! Howdy, and thanks for learning about MS with me, Boster. I'm the founder of the Boster Center for Multiple Sclerosis, where we care for families impacted by MS from around the globe. We accept all major insurance carriers, and we're currently actively enrolling for clinical trials. Today's video is on the topic of insomnia, difficulty initiating sleep, remaining asleep throughout the night, or waking up before your alarm. It's thought to be triggered by a hyper-aroused state. Now, this could be a hyperarousal mentally and thinking or physically with your body, and it can be triggered by a host of things. In fact, in this video, I'm going to review with you over 80 contributors to insomnia. Now, let's jump in. In some ways, sleeping is a learned behavior, and over time, we can actually develop maladaptive or poor sleeping habits. So our first topic is on analyzing our habits of sleep and where we might look for improvements. For example, if you have a tendency to work late into the evenings, this can sabotage your sleep because the act of working gets you riled up and then it's hard to snooze. Similarly, if you use a screen in the evenings, whether that be watching television or looking at your phone or playing a video game, the bright light wakes up the pineal gland and tells your brain that it's daytime, making it hard to fall asleep. Similarly, the activity of playing an exciting adventure video game is not what you want to do right before it's time to snooze. Along the same lines, exercising before bed for many people makes it hard then to fall asleep. There are actually things about the bed and the bedroom that we have to keep in mind. If there's a lot of ambient noise, or if it's really, really cold or really, really hot in your bedroom, or if there's a lot of light shining in, or if you have a bed partner that snores like a freight train, or you have dogs and cats that are running in and out of the room, or children that are running in and out of the room, this can destroy the ability to fall asleep. Paying attention to the way that you set the bedroom up and the habits before and during sleep can make a really big difference, guys. In a similar vein, the way that you schedule sleep matters. You need to put some thought into when you're sleeping and when you're not. For example, if you take a nap late in the afternoon or the early evening, or if you nap for a couple hours, you're going to make it much, much harder to sleep at nighttime. If you are someone that works second or third shift and you're moving your circadian rhythm around, it can really make it hard to fall asleep. Along the same lines, if you have irregular sleep schedules, on Monday you sleep 4 hours, on Tuesday you try to sleep 8, that can really mess things up. This is actually not uncommon when people work during the week and then they party on the weekends and they have different hours of trying to fall asleep. Another one that I'm unfortunately familiar with is long-range jet travel. So when I fly overseas and I spend 3 days at a conference in Europe and then I come back to the United States and jump into my clinic, it's really, really hard to fall asleep because of all the jet lag. Lifestyle decisions can also factor into insomnia. For example, if you eat a really heavy meal late at night, or if you eat spicy food late at night, that can make it hard for some to fall asleep. Smoking cigarettes in the evening is a problem because nicotine is actually a stimulant. Drinking caffeine can create the same problem. So having a cup of Java after dinner might make it near impossible to fall asleep on time at night. Alcohol can be a problem at night, both because it's a sedative which can wear off and cause a rebound insomnia a couple hours into sleep, or if you're withdrawing from alcohol, that can create a hyper-aroused state. And so drinking fluids in general in the evenings can create a problem because when you drink fluids, you're going to make urine for the next 6 hours. So if you're drinking some water at 9 p.m. and then you go to bed at 11, you're guaranteed to be making urine while you sleep, and it's going to wake you up. Psychosocial stressors, which are all too prevalent in our society today, can really interfere with sleep. And it can make it super hard to calm down and sleep at night because of all the things that are going on at work or at school or at home, etc. There are a host of medical conditions which can contribute to insomnia. And for this video, I've broken them up into categories. The first one being psychiatric illnesses. Depression and anxiety, which are very common in the MS population, can contribute to poor sleep. So can bipolar disorder, schizophrenia, and PTSD. Lastly, things like bereavement and mourning the loss of someone can absolutely create a situation of insomnia. In addition to multiple sclerosis, other neurological diseases can cause or contribute to insomnia. These include Alzheimer's disease, Parkinson's disease, ADHD, traumatic brain injury, many different kinds of headaches, and a multitude of pain syndromes. Of course, other sleep disorders can contribute to insomnia. Things like obstructive sleep apnea, where you wake yourself up because you're not breathing, and it can interfere with sleep architecture. Restless leg syndrome, where there's a compulsion to move your legs and then you have to voluntarily shake them out, making it very challenging to initiate sleep. Nocturnal myoclonus, where your legs may shake at night, or even conditions that cause nightmares. All of these things can contribute to being a bad sleeper. Many other chronic medical conditions can contribute to insomnia. Things like diabetes, kidney disease, lung disease, arthritis, heart disease, hyperthyroidism, gastroesophageal reflux disease or GERD, fibromyalgia, arthritis, and lower back pain. All of these can make it hard to fall asleep or stay asleep. And let's not forget MS-related symptoms that can contribute to poor sleep. Things like spasticity, where people can have cramps and spasms waking them up from sleep. Various types of neuropathic pain. There's a bunch of videos on this channel about neuropathic pain. I'll throw a link up above and you can check those out. Restless leg syndrome, as mentioned earlier, or nocturia, the need to wake up to pee multiple times a night. Frank incontinence of urine or stool most certainly can ruin a good night's sleep. And I want to point out social isolation, which is very common in MS, can also mess up sleep. The reason is that if you're socially isolated, you're not getting social cues about daytime and nighttime, about when everyone's up and being interactive, and about when it's time to go to bed. And so people that are socially isolated can have trouble locking in sleep and keeping to a schedule. Lastly, pathologic fatigue in MS can cause us to take long naps during the day, then making it hard to fall asleep at night. Certain groups of people actually have a harder time sleeping than others. For example, folks over the age of 60. Why? Because as we age, we spend less sleep time in REM sleep and in deep restorative sleep, and we spend more time in the shallow areas of sleep. That means that it's much more easy for folks over 60 to have their sleep interrupted. Similarly, teenagers. Teenagers have a lot of things going on. There's a tremendous amount of psychosocial stressors. There's also shifting hormones, and there's a tendency to overschedule and become stressed out about responsibilities at home, at school, in their personal life, and social. And so sometimes teenagers have a particularly hard time falling asleep or staying asleep. Women can have hormonal shifts at various times in their life, and these hormonal shifts can interfere with sleep quality. Things like during a monthly menstrual cycle, or during pregnancy, or in the postpartum period, or during menopause, can all interfere with quality sleep. And of course, there are a host of medicines that doctors prescribe you which can have a side effect of insomnia. And so I wanted to provide a list for you. It's not comprehensive, but it'll get us started. First off, antidepressants like SSRIs can contribute to insomnia. Similarly, the antidepressant Wellbutrin can cause insomnia. Stimulant medicines used very frequently in MS, things like Adderall and Ritalin and Vyvanse, Provigil, Nuvigil, they can cause insomnia. Decongestants, cold medicines, cough medicines, these can sometimes have stimulant medicines in them which can make it hard to fall asleep at night. Corticosteroids, which we use to treat MS attacks and which are also used in a host of other medical conditions, can most certainly cause insomnia, as can several heart medicines, such as beta blockers like Coreg, which could be used to control high blood pressure or abnormal heart rhythms, or even to treat headaches. Statins like Lipitor, or ACE inhibitors like lisinopril, or ARBs, are all blood pressure medicines that can contribute to difficulties with sleeping. Donepezil, which is a medicine for Alzheimer's dementia, can make it hard to fall asleep. Theophylline for asthma, and Synthroid, if the dose is off, can make it hard to fall asleep. Nicotine replacement medicines can make it hard to fall asleep because nicotine is a stimulant. Diet pills can make it hard to fall asleep, as can Dilantin, one of the seizure medicines, and levodopa, a medicine used to treat Parkinson's disease. Looking beyond prescription medicines, there's a host of recreational drugs that can contribute to insomnia. Caffeine is a stimulant, as is nicotine. Of course, so are drugs like cocaine and amphetamines. Now, interestingly, withdrawing from certain medicines can make it hard to fall asleep. So withdrawing from alcohol or from benzodiazepines, like Valium, or from barbiturates, they can cause insomnia. Also keep in mind that when you drink alcohol, the sedative effects will wear off in about 3 to 4 hours. And if you've fallen asleep, you can have a rebound insomnia. If you'd like to learn more about sleep and pro tips to make it better, click the video that's on your screen right now. Once again, my name's Aaron Boster, and thank you for learning about MS with me. Until my next video or my next live stream, or the next time I see you at the Boster Center for Multiple Sclerosis, be safe and take care.